As a young medical student, Dr. Katie Brown's dream of becoming a doctor was almost shattered by the onset of debilitating fatigue and brain fog. Later, diagnosed with ME/CFS, she struggled through med school, but managed to graduate with the help of a functional medicine doctor. But that was just the beginning of her recovery journey. For those of you who are new here, hi, I'm Raelan. On this channel, we talk about recovery strategies for conditions like ME/CFS and long COVID, connecting with as many different people around the world as possible so that we, as a community, can learn from each other and keep hope alive. Today, I'm so excited to introduce you to Dr. Katie Brown, MD from Terre Haute, Indiana, who just weeks before receiving her medical degree found herself couchbound again, but this time almost completely losing hope. Her desperate Google searching led her to a program which ended up being the key that unlocked her full remission. Today, she is dedicated to helping others with ME/CFS and similar conditions find a path to health. So please join me in welcoming Dr. Brown. Dr. Katie Brown, it's so wonderful to have you here today. Thank you so much for doing this.
Hi, thanks for having me, Raelan.
So you have had quite the journey with all of this. So why don't you start by letting us know what has this been like for you?
Sure. So I got sick my very first semester of medical school, which was great timing. And as you know, probably not a coincidence. So I went from, being a very highly functioning student and all of a sudden, this crushing fatigue, this intense brain fog. I had no capacity to deal with stress. It was a complete shutdown of my system. So even when I was, struggling to get in to go to classes, when I was there, I couldn't focus. I couldn't retain any information. And I didn't even have the capacity to go asking for help, really. It's kind of funny when you get that sick that quickly, you're so overwhelmed, you almost don't even realize how sick you are. It's kind of strange. But I ended up not passing enough of my classes to continue on to the second semester. So I got 9 months off to kind of reset. I went to my doctor. He sent me to a rheumatologist. They ran a bunch of tests. Everything was normal. The typical story. I was having some sensitivity to gluten that I was aware of at the time. He recommended that I avoid gluten. We got celiac testing done at that point, but I was kind of gluten-free and it came back negative. But anyways, I stayed sick. By completely cutting out the gluten and the contamination, I was functional enough to continue for my first 2 years of medical school, which is all just classroom-based work. I was not well at all. And every weekend I would crash. I had no extra energy for any other activities. And by the end of my second year, I knew I was not going to be healthy enough to go walking around hospitals and being on the wards all day. So I took medical leave. It was extremely lucky that I found a functional medicine physician who was involved enough with the medical school that, I had met her before, and she was willing to take me on as a patient very quickly because my primary care doctor wouldn't diagnose me with anything or write a letter saying I needed medical leave. But my functional medicine doctor, Dr. Steenstra, she did. And she took me on as a case from then on. So for that year off, I got better. I improved. I wasn't 100% better, but I started to be able to tutor a little bit on the side. Dr. Steenstra was prescribing some kind of functional medicine type supplements and medications that seemed to be helping. But as soon as I went back to school, I decompensated again. It was quite frustrating. Dr. Steenstra at that point started me on Cortef or hydrocortisone, and I was basically taking the same doses that someone with Addison's disease would. It's basically artificial cortisol, so it was supporting my stress system, even though my cortisol levels were all normal. Dr. Steenstra was willing to do that for me. And it did help. It allowed me to limp my way through the last 2 years of medical school. My very last year, I found myself once again in a severe crash. And I'm like, I'm still on this core TEF, but I'm not functioning. There's no way I'm going to get through residency like this. And throughout this entire time, I had held on to the hope of, I will get better. I'll find a way to get better. And once I'm better, I'm going to help other people get better. And I, for the first time, I started giving up hope. I did a little bit of kind of desperate Googling. Up until that point, I had not internalized or accepted the diagnosis of chronic fatigue syndrome, simply because when I asked my primary care doctor for that diagnosis, she says, "You don't want that, no one gets better," and refused to diagnose me. So I hadn't done any research on how to recover from chronic fatigue syndrome specifically. I had looked into various other diagnoses and things like mold or adrenal insufficiency, but not chronic fatigue syndrome specifically. And I started to do that at this time, and I found a program called ANS Rewire, which probably many people in your audience will have heard of. It's pretty popular. Dan Neiffer is the guy who started that program, and he is of the opinion that autonomic nervous system dysfunction is at the core of chronic fatigue syndrome. I watched his introductory videos where he explained that, and it was the first thing that made sense to me. It kind of explained everything that was going on. It explained why this happened when I started medical school. It explained why being glutened was kind of associated with this, but even when I wasn't being glutened, I was still sick. So I signed up for his program, and within 3 months, of course, I graduated from medical school around this time also, so I got some time off. But within 3 months, I was better than I had been for the past 6 years. I was doing heavy physical work out in my garden, and I just felt great. And I was like, oh, I got it. I figured it out, like this last piece of the puzzle. And so during residency, I did my family medicine residency in Illinois. And I've been trying to educate other people about this condition. Of course, COVID happened around that time, and a lot more doctors became familiar with the term long COVID and chronic fatigue syndrome. And we got an ICD-10 code, which was nice. So since
what? Sorry?
an ICD-10 code. So whenever you're telling insurance companies, through the electronic health record, this is what the patient has, so you should, reimburse us or cover this medication or cover this test, you associate it with an ICD-10 code. And for the longest time, the closest thing we had was chronic fatigue unspecified. Chronic fatigue syndrome didn't actually get an ICD-10 code until COVID actually kind of brought enough awareness to whoever makes those that it's actually a thing. It's ridiculous. Wow. Yeah. So that's kind of my story. I relapsed a couple of times throughout residency when things were particularly stressful. I recovered quickly, and I'm doing really well now. So
I can't even imagine how stressful it was to go through medical school while facing this.
It was horrible.
You and I were saying before, there's no good version of this where everyone has a really rough time, but that just sounds so incredibly intense. And I feel like it must have been perplexing and frustrating, I would imagine, that because you're immersed in the whole medical field, it feels like you should be in the place that you need to be to find your answers quickly, but still you weren't getting really what you needed. And the whole, I don't want to diagnose you with chronic fatigue syndrome. No one gets better with that. You don't want that.
Yeah, you don't want that. Right. Exactly. It was
that one.
It really opened my eyes to how completely ignored and neglected this condition is within our medical system as a whole and medical education in particular. It was never mentioned in any of my classes. Things that, a grand total of 100 people in the entire history of time have ever been diagnosed with were mentioned, but not this.
So what I'm also find it impressive that you went to, 'cause I know Dan, I've had him on the channel a few times. I can link a few of his videos in the video description. Amazing. He has a great program, as you know. But I think it also must take some humility as a medical professional to go turn outside of the medical profession to get your answers. So Dan is skilled and knowledgeable, and but he's not a doctor. So what is that like as someone who is a medical doctor to be like, okay, I'm gonna venture elsewhere?
Sure. Doctors, I think, know more than anybody how screwed up our system is. It doesn't. It doesn't take that much humility. But when you try everything, you got to do everything you can because it's your life. You either give up or you keep looking. And I had exhausted all of the medical resources. So
yeah, I mean, imagine you're human like the rest of us. Despite being a doctor, we put doctors on these sort of godlike pedestals, but you're a human like the rest of us. And I guess just even me, I was very much wanting to get my answers from conventional medicine, mainstream medicine, and that wasn't happening. And I never would have thought I would have resorted to some of the voodoo that I did, but desperation takes you there. You're like, all right, if it's unicorns and sparkles are going to cure me, I will try it.
As long as it works, I don't care.
If it worked for even one person, let's give it a shot. Yeah. So what do you think causes CFS?
I think many different things cause CFS. But the CFS, I think, is what happens when our autonomic nervous system becomes overwhelmed and is unable to complete that overwhelm stress response and move back into rest and digest and homeostasis. So what sorts of stressors play into that are as numerous as there are people on the planet. So that's why I say many things cause CFS. But I think that core dysfunction is kind of what makes, first of all, the symptoms of CFS fairly unique, but also it gives it the unique feature of you can clear up the things that caused the problems in the first place, but you will still remain sick until you're able to get your nervous system out of that negative cycle.
And how does one get their nervous system out of that negative cycle? It's $1 million question.
Yeah, it is. And it's one that I'm still working on because it seems like what works for one person may not work for another. And there's a million different ways to do it. And some may work for you and some may not. So I know Dr. Sally Riggs is very into polyvagal approaches, which I never used personally, and I'm still learning about them. Dan Neiffer's approach seems to be a lot of education, and then he's got like the brain training component to his program too, which I never even really used. For me, it was finding the things that were keeping my nervous system reactive. For example, in one of Dan's first videos, he recommends eating regularly and avoiding hypoglycemia and these low blood sugars and these crashes that stress out our system, our nervous system. And just making that one simple change and really being mindful about it. Because I knew I needed to eat regularly in order to feel good, but I wasn't approaching it in a consistent way. So I would get super crashy and tired and hangry, but I'd be too tired to get up and get food. And then I would just sit there and be let my nervous system kind of wig out a little bit. So once I stopped doing that, I started to get a lot better. But I had kind of already dealt with the gluten intolerance and the medical school stress that was kind of my initial issue. So I think it probably depends on the person and what sorts of stressors are causing it. If they have, complex PTSD or childhood trauma, their recovery may be a little bit more involved and they may need more intensive nervous system regulation or therapy or something like that.
Yeah, it makes sense for all the people that I interview and the things that people tell me. It's it feels kind of all over the map, but they're all addressing a similar thing. Some people say they got really deep into meditation and they're meditating multiple hours a day. Other people, it was, I left a stressful job and that seemed just to be the thing that kind of got everything else going. Yeah. Or, I used to really spend a lot of time in nature and I was in this city life and I was miserable. So I started spending more time in nature or, just different things of getting their life more in line with how they wanted to be living it and reducing stress and dealing with past trauma if they had been carrying things around. And it can feel a little bit all over the map, but when you look at it, when you zoom out and you look at it, it's all addressing the same thing.
Right.
At least very similar things.
Yeah.
Yeah. So we have channel members here, people who join the channel for a couple bucks a month to support the channel. Thank you, channel members. And a few of them have sent some questions in for you that you said you will be very kind and will answer them for us. So if it's all right, I'm going to send a couple of those your way.
Sure.
Okay. So first one is, I hope I get the names right. Domsterman wants to know, what is your view on Dr. John Sarno's work, TMS, as it relates to ME/CFS? And what would your approach be to deal with repressed emotions and brain training and all of that?
Yes. When you first sent me these questions 2 days ago, this was my favorite one because it is so nuanced and challenging and interesting. So I'm super excited. But I'm going to ramble for a bit. For people who aren't familiar, John Sarno was a doctor who theorized that chronic back pain was caused by repressed emotions. And these repressed emotions had an effect on blood flow to the muscle, which he called tension myositis syndrome, or TMS for short, and this caused the chronic pain. So he theorized that chronic back pain, rather than being a problem with the back, was actually a problem psychologically with repressed emotions. TMS has since been used as an umbrella term to cover any physical symptom that has an emotional or psychological origin. So this person seems to be asking, how much of CFS is psychological in its origin? And the question is very nuanced and complex because, like I said, chronic fatigue syndrome, in my view, is caused by autonomic nervous system dysfunction. The autonomic nervous system helps us deal with stress, and it does not differentiate between physical stress or emotional stress or psychological stress or imagined stress. It's all the same. It mobilizes the same systems in our body. So to ask, how much of the stress is psychological versus how much of the stress is physical is going to vary from one person to another. What I will say is I don't consider CFS to be TMS or a psychological problem. I consider it to be a nervous system problem. And probably many other TMS conditions or conditions that have that label are also nervous system problems. So it's a nuanced discussion because when we draw a hard line between psychological versus physical, it breaks down. Like, there is no hard line. Everything that we experience as psychological is physical, and everything that's physical has a psychological component. So the autonomic nervous system, it sends signals to our body, and our body sends signals through our autonomic nervous system back up to our brain. And they influence one another, and they're not like two separate systems. So we know that there's things that go wrong at the cellular level in chronic fatigue syndrome. You can measure, how hard a muscle cell works, and take a muscle cell from a healthy person and a muscle cell from a chronic fatigue syndrome person, and there are differences. And, obviously, if you're working with a single cell in a petri dish, there's no psychological component. So for that reason, I say, no, it's not psychological, but there's definitely ways to influence it through psychology and mind-body treatments.
I love that answer. That's a complicated question, and I think you explained it perfectly. So thank you for that.
Thanks. I've been trying to find a way to say that somewhat succinctly and coherently for a while.
I know you did very well. Yeah, that was a tough one. Okay, next one is Nola Mayer. She would love to know your thoughts on using nicotine patches. I've had a few people ask me about this for long COVID or vaccine injury. There's different studies and things floating around out there talking about some amazing results. So
sure,
what's going on there?
I don't know. I tend to be hesitant to prescribe, whether it be nicotine or stimulant medications, anything that's possibly causing masking of symptoms and helping you to push through and ignore your body's signals. Are nicotine patches doing that? I don't know for sure, but I imagine that's probably the sort of effect they're having. And while it might be a useful tool, especially if you have a time-limited task that you need to get through, I think probably the healthier way to deal with this illness is figuring out what the root causes are that are keeping your nervous system dysregulated, and then resting and allowing yourself to heal. So while I would be open to prescribing these, they wouldn't be my first choice.
Yeah, I remember when I was sick, my doctor would prescribe different things. It wasn't nicotine, but I think with a similar idea behind it. And it felt sort of like having the flu and drinking Red Bull. Like it just, I had more energy, but you could tell it was just sort of masking what was still there. And it didn't feel like it was getting me better. I don't know about nicotine, but just, interesting to hear what could be going on there. Okay, I have one from Skyrunner 2. Thank you, Skyrunner 2. They want to know how to go about approaching other conditions, either acute, like when you get a cold or the flu, or even a physical injury or chronic illness aside from ME/CFS, because life can sometimes really not be fair.
Yeah.
While on recovery from CFS. So how do you deal with piling more stuff on when you're already in this state?
Even now, like when I get a viral illness, like I just stop. I stop working, I cancel all my appointments. It doesn't even matter if I'm like feeling that bad. Like I just prioritize rest because I've learned my body just needs that sometimes. Like I work really hard and I enjoy what I do and my work is energizing to me. But when my body says rest, I rest. And when we have chronic fatigue syndrome, we need to rest even more so. So if you have a surgery, even like a minor procedure, like a dental issue or something like that, rest before, rest after, rest as much as you can, both physically and emotionally. Like don't stress about it. And just do your best. If you need, medications, like stimulants or a nicotine patch to help support you through that, that's okay. But don't use it as a way to push more than you need to.
Yeah, it's important to remember that these things are going to hit you differently than if you weren't facing ME/CFS. And I think we still put those pressures on ourselves. I got a cold or I got the flu. I've got 4 or 5 days max where people are going to put up with me laying in bed. But, you need the time that you need, and it's going to look different for everybody. I think it's a lot about just that permission we give ourselves and the patience with it all and the self-compassion with it. Yeah, this sucks and it's hitting me hard and I got to just ride this out.
Yeah, it's hard because everyone wants to know, like, how can I keep doing things even when I'm sick? And I'm like, well, I mean, we could talk about that, but it's not going to serve you in the long run.
Yeah.
You eventually just, what you really need is to just rest and allow your body to recover.
Yeah, and a tough one for me too was just admitting that I needed help, because sometimes these things could go on for a really long time and then I couldn't do it all, and just giving myself that permission, because we say if we had other illnesses that had more recognizable titles like cancer, we wouldn't hold back to ask a family member to bring us some meals. And I found that when I did break down and ask people for help, they always reacted way better than I thought. And people often felt kind of like happy and honored that I would be like, hey, can you help me out for a bit? Drive me somewhere, bring me some food, help out with my kids. I don't have kids. Just when I hear from other people, just drop off some groceries. Realize that you might need some help to get through it.
Yeah, asking for help is definitely one of those key skills that you have to learn with this illness. And it's a skill. It's hard.
It is a tough one. Okay, Amy, she wants to know if you're familiar with polyvagal theory and practices and what your thoughts are on focusing treatment primarily on nervous system regulation. So I think we have a sense of what your take is on this, but should we only be addressing the nervous system? And what are your thoughts?
I definitely don't think we should only be addressing the nervous system, because the nervous system became dysregulated for a reason, and you have to identify what those reasons are. And there's also other things that you should be ruling out. Even if you meet criteria for chronic fatigue syndrome, there's mimics and things like that. So it's useful to have a doctor on board who knows what they're doing to help identify things that need to be addressed in order to make it easier for you to get your nervous system back up and functioning. But once you've dealt with those kind of underlying, I call them root causes, then polyvagal approaches or any other approach that's going to help the nervous system find balance again is going to be useful. I am familiar with polyvagal theory. I think the shutdown aspect of the stress response makes a lot of sense in the context of chronic fatigue syndrome. Now we kind of get shot back into that fight or flight mode and then back into this withdrawn, overwhelmed state. I think it explains our symptoms really well. I don't know, I haven't tried polyvagal exercises before or in my patients yet, but I do hope to do that, and I'm curious to see how well they work.
I did a video a while back kind of walking people through polyvagal theory and what it looks to work with that in your recovery. So if people aren't familiar with it, you're like, what is this polyvagal theory? I'll link it up here and you can check it out. Okay, next we've got Area Man wants to know if you think ongoing neuroinflammation has a role in producing ME/CFS symptoms.
I think it's likely. I looked up a paper for this when I got this question because I wasn't sure. And there was a meta-analysis done that suggested that there are things like lactate buildup more in the cerebral spinal fluid of patients with CFS than healthy controls. And that in and of itself can cause inflammation in the brain. We know that there's some brain remodeling. The brains look different under imaging, which can be explained by inflammation. So yes, possibly through an oxidative stress pathway or the mitochondria not functioning as well and you get this buildup of lactate. I think there's a few different mechanisms for inflammation to build up and cause symptoms. I don't know that it's the main mechanism for symptoms, just because in my own personal experience, symptom onset and recovery can happen quite quickly, whereas I would think inflammation would take a little bit more time. I don't know. It's probably a component, but I don't know how big of a component it is.
Well, we got quite a few questions. We won't be able to get to them all, but what's one last good one? I think this is such a common question. This is from Greg. Thank you, Greg. How to safely expand your activity. So when your family wants to do things or go on a little vacation, how should you go ahead and do that? Should you stay at home? How do you know when you can start doing more, and how do you do that?
For me, once I started the ANS Rewire program and I kind of got a basic understanding of what was going on, I recovered really quickly. I got off my medications way more quickly than my doctor would have liked. But I had this knowing, this sense of I'll be okay. This is going to be okay. And I also did a lot of resting, and it was easier to choose rest because I knew that recovery was around the corner and I wasn't just trying to milk life for all it was worth because this is the only life I had. So it really depends on where you are in your recovery. During that acute phase when you're in PEM all the time and you haven't learned how to pace well, going out and doing something extra like that is probably not going to be helpful. You need a really dedicated amount of time, maybe 3 to 6 months, where you prioritize rest and you prioritize pacing and recovery. And I think after that, especially if the root causes have been addressed, you'll be healthy enough to go out and do those things, and you'll know better where your limits are. But there is kind of a window of time where you're going to need to prioritize your rest and forego those sorts of things. But it shouldn't be lifelong. It should be temporary.
Yeah, I think it can be a lesson in patience, but for most people, myself included, slow and steady ended up winning the race. And people talk about it in the terms of pacing or whatever you want to call it. And I remember interviewing someone way back. She's like, I hate pacing. I'm like, I know, me too. That's what got some of us into this mess in the first place, is we just want to go, and not listen to our bodies ever. But for a lot of people, and everyone, of course, looks a little bit differently, but it's just about, instead of maybe jumping in on a family vacation, starting by going for a 3-minute walk and seeing how that goes. And then if the next day you feel okay, try doing that again, or maybe go for 4 minutes, but just trying to do too much too fast seems to backfire for a lot of people. There are those rare cases where people just, I'm thinking of one guy in Australia, read a Sarno book and just went outside and chopped down a tree. Like, he just was instantly better. Those book recoveries. But I think that rapid success is the exception, not the norm. So that slow and steady approach seems to be what is safest.
And I think if you do fall into that camp, you'll know it and you won't have to ask permission to go out and do something. If I told you not to, you'd go out and do it anyways. So.
Well said. So you are working with people now, with patients now. Okay, what is your approach to recovery? Tell us a bit about that.
So my clinic just opened. I'm onboarding my second patient as we speak. So I keep a very open mind. I'm still kind of forming how this clinic works. So if people have suggestions, feel free to leave them in the comments. But for right now, what my general approach is to, number one, I'm acting more as a consultant than I am as a treating provider, at least when possible, because I'm hoping that's going to allow me to take a higher volume of patients and keep my prices low. So I have 3 phases to my clinic. In the first phase, I'm going to assess you and try and figure out, number one, if you have chronic fatigue syndrome, what things we need to rule out, and what root causes we need to consider or test for. And then I'll kind of give you that write-up, that recommendation. You'll take that to your doctor and you'll get all those things done. And then you'll come back to me for phase 2, which is the treatment phase. And so I'll take all that information that we've gathered and I'll create a treatment plan. And this will include things, mind-body things like pacing. It'll also include medications or supplements, whatever I think is going to be helpful for you. And then for the third phase of the clinic is follow-up. And I'm just going to include this for everybody. Every 6 to 12 months, I want to check in with you. How are you doing? How did my recommendations affect you? Are you better? Are you worse? And then if you're not getting better, I want to continue to work with you. And as I'm growing and learning more about things that can cause CFS or things that can help treat CFS, I'm hoping to be able to eventually help everybody.
And would people need to come physically to your clinic to see you?
99% of what I do is virtual.
Okay.
During phase 1, I do want to physically examine you once, and you have the option of either coming to my clinic in Terre Haute, Indiana, or having me travel to you. And I charge like $100 per hour of driving time.
This is incredible. I'm so blown away that things like this exist now. As you know, there's such a massive demand for it. And Just, yeah, it stirs up something in me that there are doctors and clinics out there who are not only taking patients with these conditions seriously, but also have a lot of really good insight and strategies. And like, yes, we can work with you instead of, well, nothing we can do. Sure, I'll give you the diagnosis. Yeah, absolutely incredible. For people watching, everything you need to know to learn more about Dr. Katie Brown's practice and her clinic will be in the video description. So definitely expand that and take a look, because how amazing is this? That there is a doctor that you can go see that is going to work with you and stick with you and wants to work with you long term and make sure that you're doing okay. And if you're not doing okay, assess what's happening and what we need to change. It's just really amazing. Yeah.
Thank you. It's quite selfish of me because I was sick for so long and I always said, I'm going to get better so that I can do something with this knowledge. And now I have the chance to. I'm very excited about it.
Yeah, I say this sometimes on the channel, and I always feel a bit guilty, but I was like, if these illnesses have to hit people, if that is unavoidable, like, maybe let's have a few doctors get hit, because just the rest of us, like, you can't get this anywhere.
Yeah.
So yeah, I'm, really sorry that you've had to go through all this. Oh my goodness. What a nightmare. But what good is coming out of it now? So
I'm actually very thankful that I went through it. I think my life is going to be much more meaningful, and I'm going to have so much more joy because of what I went through. And I hope other people are going to be able to say the same.
Oh, absolutely incredible. Well, really looking forward to the questions and the comments from those of you watching. So please don't hold back. Let us know what you think. Ask your questions of Dr. Brown, and look into the video description and get in touch with her, or at least learn a little bit more about what she's doing. So yeah, thank you so much, Dr. Brown, for your time today and for all that you're doing for people. I really appreciate it.
My pleasure.
And thanks as always to those of you watching. Thanks to channel members who sent in your questions. If you're watching and you're interested in becoming a channel member, you can click that join button and learn about all the extra perks and whatnot that you can get. And I just appreciate the support. It truly helps the channel to keep going. So thank you for watching. I hope you got a ton out of this video. I hope you enjoyed it, and I hope to see you in one of these next ones I'll put up here for you.